Hello, Dr. Heath and fellow SLP doctoral colleagues. Today I'm going to present to you my assignment on the multiple baseline across participants design. The research question I used for this assignment was, what is the effect of the comfort feeding only strategy on the quality of life of patients with terminal cancer receiving palliative care? 3 participants between the ages of 70 to 75 years old were recruited for this study. These patients were also, these participants were also patients on an acute palliative care unit. The additional inclusion criteria for this study was a formal diagnosis of a terminal cancer from a practicing oncologist, in addition to a prognosis of less than 3 months. Additionally, the participant has to have provided a poor quality of life score after completing a quality of life scale with their palliative care physician. Additionally, a palliative performance scale score of 40% is also needed. This score indicates that the participant is fully conscious and capable of providing consent, as well as the ability to express their wants and needs. Finally, a formal referral for SLP indicating the need for comfort feeding is required from the patient's palliative care physician. The referral must also claim that the participants are not appropriate for enteral feeding or any other kind of oral diet that would promote sustaining or prolonging life. This criteria is vital to this study, as the participants will be required to complete a swallowing quality of life scale daily throughout their participation. The exclusion criteria includes a diagnosis of brain cancer or brain metastases. This is because their level of alertness and comprehension can fluctuate and deteriorate quickly with the progression of their disease. Additionally, anyone who is still able to maintain a more active lifestyle as well as eat full meals will be excluded. This is because the comfort feeding intervention that is going to be implemented during the study is meant to provide comfort only to the palliative care patients and is not meant to sustain or prolong life. Additionally, this does include a prognosis of longer than 3 months. So those participants or those prospective participants would be excluded from the study. The variables for this study include the comfort feeding only strategy, which would be the independent variable, because this is my intervention. And then the dependent variable would be the participant's quality of life, because this is what I will be measuring. Before the intervention is implemented with each participant, the swallowing quality of life scale, which will be the measurement tool throughout the study, is going to be used to achieve a baseline level of performance. The scale takes approximately 3 to 5 minutes to complete. So the participants should be able to achieve daily administrations of the scale until they reach the determined criteria level. So initially, the participants will not receive any treatment. However, they will be required to complete the swallowing quality of life scale daily in order to establish a baseline quality of life score. After the baseline quality of life trend has been achieved, intervention will begin with participant 1. While this participant is receiving the comfort feeding intervention, participant 2 and participant 3 will continue to complete the swallowing quality of life scale without any intervention. When participant 1 has met the determined criterion level, intervention will begin with participant 2. So as you can see on the chart that I created here, the set criterion level was a score of 6 on the swallowing quality of life scale, and a score of 6 is quite high, meaning they have a very good quality of life. So once participant 1 has reached the criterion level of 6, intervention will begin with participant 2. Participant 3 will continue to complete the swallowing quality of life scale daily without intervention until participant 2 has reached their criterion level of 6. Finally, once participant 2 has reached the criterion level, intervention will be implemented with participant 3 until he or she reaches the determined criterion level. So again, throughout the intervention period, the participants will continue to complete the swallowing quality of life scale, and their scores will be recorded on a graph, which I will show on the next slide. And this is to determine if the participant's quality of life has improved with the implementation of the comfort feeding only strategy. So based on this graph, it includes a baseline as well as the criterion level for each participant. At the start of the study, when the participants were completing the swallowing quality of life scale, the total raw scores from each of the administrations was used to determine the baseline trend. So you could see from this graph, the baseline sessions for participant 1 were sessions 1 through 4. They were sessions 1 through 8 for participant 2, and for participant 3, they were sessions 1 through 12. And then the scale was continued to be completed by each participant throughout the intervention period until the criterion level of 6 was reached. So based on the data provided on this graph, the comfort feeding strategy had a positive effect on the quality of life of the 3 participants. The scores from each of the administrations of the swallowing quality of life scale were plotted on the individual participant graphs in order to measure the improvement of their quality of life as they participated in the comfort feeding intervention. Additionally, as you can see, they maintained a stable baseline throughout the non-intervention period and only showed improvement in their quality of life after the implementation of the comfort feeding only strategy. So in palliative care, individuals are focused on improving multiple components of their quality of life, which can be compromised due to their terminal illnesses. The comfort feeding only strategy was developed as a supportive measure to provide individuals with controlled amounts of food and fluids that they request in an attempt to improve their quality of life. However, there is minimal research discussing the actual effect comfort feeding has on an individual's quality of life who is also receiving palliative care measures. So this study was conducted to determine if there was an effect between the implementation of the comfort feeding only strategy and improvement in the patient's quality of life. Based on the results, all 3 participants showed an improvement in their quality of life after the implementation of the comfort feeding intervention as measured by the swallowing quality of life scale. This is the abstract from my study. It discusses the purpose, the methods, the results, and the conclusion of my study. And based on the conclusion, again, you can see that the comfort feeding strategy that was used as the intervention in this study positively affected the quality of life of the 3 participants. And then by continuing to provide palliative care patients with comfort feeding, there could continue to be improvements in their quality of life. And these are my references. Thank you so much for listening. And if you have any questions, please let me know.